As the second wave of COVID swamps the country, new variants making things even more dangerous. Once again, the focus has landed on long-term care homes, where most of the deaths in Canada have occurred. They are among the first places to get vaccinated, but with shortages, that's deeply slowed down the rollout. So it's no surprise that the NDP has now rolled out its first campaign promise for a potential election to put $5 billion into long-term care and to try to stop the for-profit model in long-term care by 2030. But remember, this is actually provincial jurisdiction. So how would it work? And is it a sign that all the parties are prepping for a possible spring election around the budget? Let's find out. Joining me now is the leader of the NDP, Jagmeet Singh. Mr. Singh, always a pleasure to have you on the program. Look, you and I have talked a lot about this long-term care issue before. This is squarely a provincial jurisdiction. So what exactly do you think the federal government can do to really take the for-profit model out of long-term care?
Well, a couple of things. First off, we have to acknowledge that I've spoken to many families that have shared their heartbreaking stories about long-term care. This is one of those things where people are saying, we don't want to hear excuses, we want to hear solutions. So what we're saying is we're not in any way disrespecting jurisdiction. We're saying that should not be a barrier to showing some leadership and working with provinces to get some things done. When it comes to profit, first of all, we have to be clear. For-profit homes are overwhelmingly worse, more infections, more deaths than anywhere else. And so what we're calling for is a couple of really concrete things. First off, Revera is wholly owned by a federal agency. Make that public. The federal government can do that. Secondly, bring in long-term care and home care under the same principles that provinces already agree upon, the Canada Health Act. Increase funding in line with those principles, which would immediately increase the quality of care. And then for a long-term goal, so that this never happens again, we need to make sure we're working with provinces, providing the funding to get rid of profit in long-term care.
Okay.
It can be done. There's various steps we can take.
Justin Trudeau's asked about that. He said, look, again, he always says the same thing. He said, look, even for Revera, which he says long-term care homes, that is clearly provincial jurisdiction. If they want to do it, we'll work with them, but they can't do that unilaterally. Do you buy that?
No, I think that what the Prime Minister should be saying is, we are going to buy it out and make it national. We are going to make it public right away. We're going to provide funds so that provinces that are already faced with massive shortages when it comes to long-term care beds, what province would say no to new beds and new funding to care for their seniors? I don't understand how any province could say no to that. And I certainly don't see how the public would allow any premier to say no to new publicly funded beds for seniors to be cared for with dignity.
If this increased funding for long-term care and other things you've asked for are not in the spring budget, and here you are rolling out a campaign promise, are you prepared to vote against the spring budget and trigger an election this spring?
I've been very clear on this point. We are not looking to trigger an election. And Justin Trudeau's sole focus in this pandemic, in this moment right now, should be on getting vaccines for Canadians. That should be the only thing he's working on. He should not be planning an election. He should not be spending time or resources doing anything other than getting vaccines to Canadians. Delays in vaccines mean more people get sick and more people die. So that should be his sole focus, and we're going to continue to hold him to account on that.
But I'm just trying to figure this out. You say he should not be preparing for an election, and you're literally on this program rolling out an election promise. So, what is it?
Well, this is something that's in an urgent crisis. Like long-term care, I've met with so many families that are saying, well, why is this happening? If we knew these problems happened in the first wave, there is no excuse for them to continue in the second wave. And we're seeing our loved ones die. The pandemic has disproportionately been borne out on the lives of seniors. That has to end. So this is something that we're committing to do, but we want to see the government do it right now.
Let me just dig deeper into vaccine rollout. It is the key issue. The Prime Minister has repeatedly said, despite the shortages now, the March target of 6 million doses of Moderna and Pfizer will be met. He's talked to the EU about it. He's talked to the CEOs of those companies, and he guarantees that will happen. Do you trust that? Should we be calmed about all that?
It's hard to trust it given this context. When we first heard about vaccines, Canadians were excited. This was that glimmer of hope in a really difficult time. And this was that moment where people thought, you know what, maybe we're going to get past this. The vaccine is going to mean that we're going to be able to see our loved ones again, and we're going to be no longer worried about getting sick and our loved ones dying. But then the delays were announced. Then the misinformation or the lack of clarity, the Prime Minister saying one thing and Minister coming out with another when it comes to local production. All of these delays and lack of clarity and frankly lack of transparency are eroding public trust. And we want the public to trust us. We want the public to trust that the vaccine is going to be there and they can take it and they should take it. But when the Prime Minister is failing to provide a clear plan, is being so untransparent and not providing clarity, it actually erodes that public trust, and this is a problem. People are
what's
upset.
the clarity, I'm just trying to figure out what's the clarity you're looking for. He's told the provinces, as soon as we know shortages, we tell the provinces. As soon as we get the numbers from the vaccine makers, we deliver them to the provinces. You're going to get 6 million by the end of March, you're going to get 20, then you're going to get 20 million, and then you're going to get every Canadian who wants it by September. That's the plan. What transparency are you looking for?
A number of things. First off, we talked about local production. We are not ever going to have the confidence to know that we're going to receive the doses that we need unless we know that we're able to produce them in Canada. He comes out with an announcement saying we'll have the capacity by September. His own minister says, no, it's going to be end of the year. Then the NRC says it's going to be in 2022. That's something that hurts public trust. We don't know how many Moderna doses we're going to receive next week or the week after. That erodes trust. He says on one day that we're going to receive a certain amount, then days later says, okay, there's been a delay, we're not going to receive it. The premiers themselves are asking for, well, what are in the contracts? Why don't we know what are in the contracts? Other countries have done that. All of this lack of clarity, coupled with the final piece is, you can't just set a deadline without telling us how you're going to achieve it.
All right, I got to leave it there. Mr. Singh, great to have you on the program. Appreciate it very much, sir.
Always a pleasure. Thank you.